For months, local health officials have been trying to avoid using the Austin Convention Center as a field hospital, but they can't avoid that anymore. KVUE's Luis De Leon is live at the Convention Center for us tonight, where just one person is getting care so far. Right, Luis?
Yeah, that's right, Brian, and this is expected to help free up some much-needed space for beds in our local hospitals. There's 25 beds ready inside that building behind me right now, but it has the potential to serve up to 1,000 patients. That's only if it's absolutely needed, though. Some local doctors told me today that now that we do have at least one person in that building, it should serve as a warning for how serious the situation is. It's a building thousands drive by every day. That's now officially playing a new role in Austin during the pandemic. The Austin Convention Center downtown, set up as an alternative care site for COVID-19 patients, took in its first on Wednesday. A red flag, some doctors say.
That's a sign that things are bad. You know, we never want to take patients out of a hospital.
Dr. Natasha Kathuria, an emergency room doctor in Austin, says despite this, hospitals in our area are doing fine with providing care, but providing space is the issue, which the center may help with. Travis County has more than 600 hospitalized as of Wednesday for the virus, nearly 200 in the ICU, a little more than 100 on ventilators. Rising numbers pushing doctors.
It gets exhausting, and it's been almost a full year of this for us, of going in and out of rooms and having to see all this heartbreak and suffering every day. We're all exhausted. We're tired. There is a new sense of hope, though, with the vaccine that's really, given us another push of energy.
Other doctors, like the medical director of adult ICU at Ascension Seton Medical Center, Dr. Jordan Weingarten, says the same.
Everybody has had opportunity to be vaccinated. I think that's a huge psychological benefit there. We definitely are, as all hospitals in the area, feeling a little bit of a crunch in terms of the numbers of patients we have. We're still able to provide good care, I think, to our patients, but at some point, these are finite resources. We have a limited number of beds, a limited number of people, and if the numbers keep going up, we will have issues everywhere. And the building behind me is expected to take in COVID patients that need a lower level of care or are on the road to recovery. And you guys, local health officials said earlier this week that as soon as tomorrow, we could run out of ICUs in our area as hospitalizations rise.